So our abstract, we looked at the National Cancer Database, which is the largest oncology outcomes database in the United States, capturing an estimated 70% of patients diagnosed with lymphoma annually. So we looked at diffuse large B-cell lymphoma, and specifically we looked at the outcomes of diffuse large B-cell lymphoma patients by racial identity. So, and we looked at how Black patients compared to white patients, how the survival, if there was any survival differences present, or if they did the same. Similar studies have been done in the past on a smaller scale, mainly single institution or 2 institution studies, and those have had some similar findings but conflicting findings. So we sought out to kind of more uniformly address that important question. Some of the key findings include that we found patients who were Black have had a few different disparities. Namely, they had earlier age at diagnosis. Black patients were more than twice as likely to be diagnosed with diffuse large B-cell lymphoma at 60 years or younger, which is a very young population, compared to white patients, in which it was about 28% or so were diagnosed at 60 years or younger. Which is pretty remarkable. Additionally, we found that Black patients were more likely to present with advanced stage 4 disease than their white counterparts. And alarmingly, we found that Black patients were more likely to have HIV positivity at diagnosis, or HIV positive lymphoma, which conveys worse outcomes. We also found that Black patients had similar rates of chemotherapy treatment compared to their white patients. However, Black patients were less likely to receive radiation therapy, which may contribute potentially to some disparities in those populations. For overall survival differences, we found that when matched with similarly aged patients 60 years or younger, Black patients did significantly worse with overall survival outcomes than their white counterparts. Namely, those Black patients 60 years or younger had worse overall survival, and patients 61 to 79 had worse outcomes compared to their white counterparts. However, in the oldest patients, those 80 years old or greater, actually had similar outcomes. Of note, it's important to realize that for our survival analysis, we excluded all HIV positive patients. So the disparities that we observed do have to do to other factors than just HIV positivity. We also found that on multivariate analysis, Black race was independently associated with worse outcomes and was an independent prognostic factor for an increased risk of death, was Black race. So, this is an important finding. So on further analysis, we did something called a propensity match analysis, where we match on a 1-to-1 fashion based on age, stage, comorbidity score, income level, and insurance status. We matched on a 1-to-1 fashion Black and white patients. And when we did that, we had a cohort of roughly 11,000 patients. And in that cohort, we found that there was no survival difference between Black and white patients, suggesting that the factors that may have led to the disparity could include income level and insurance status, which previously we did find in our demographics that Black patients were more likely to be uninsured than their white counterparts, and they were more likely to be in the lowest income quartile.